Sounds good. Good afternoon, everyone. Thank you all for joining us for this news conference, and thank you to Sharon Sinkler for once again providing interpretation services for us. My administration has prioritized continuous improvement in the performance of our department's services, especially those that are critical public health and safety services, and we have continued to see great progress in the data measurements that we monitor, even during the COVID-19 pandemic. We are grateful and proud of the dedicated service that our city's first responders provide to our residents. And today we are here to update the community on the excellent work of Lincoln Fire and Rescue. They recently received the Cardiac Arrest Registry to Enhance Survival, or CARES data for 2020. And I'm proud to announce that LFR continues to increase their overall cardiac survival rates. And when I say that Lincoln, Nebraska is the best place to suffer a cardiac arrest, I mean it. These successful outcomes can be attributed to the strong network of partners who respond when an individual suffers a cardiac arrest event. Bystanders, dispatch, Lincoln Fire and Rescue, the Bryan Heart Institute and CHI, Nebraska Heart Institute, to name a few. In Lincoln, our residents are recognizing when a patient is in cardiac arrest and are doing bystander CPR at a rate of 70%. That's up from the goal of 65%, and much higher than the national average of about 40%. So Lincoln Fire and Rescue responds and arrives within 8 minutes, 81% of the time, to Delta and Echo calls. Lincoln Fire and Rescue continues to meet or exceed cardiac arrest survival standards and continues to increase and push those standards. So today, we have representatives from the crucial network that providers that provide these critical contributions that result in these successes for our community. And first up, I'd like to introduce Dr. Jason Kruger, the Medical Director for Lincoln Fire and Rescue. Dr. Kruger is here to explain what these numbers mean to the residents of our community. Dr. Kruger?
My name is Dr. Jason Kruger, and I serve as the Medical Director for Lincoln Fire and Rescue. I oversee the emergency medical services, protocols, and procedures utilized by paramedics and EMTs in the pre-hospital setting in Lincoln. We are proud to announce our community's 2020 cardiac arrest statistics. In 2020, LFR responded to 148 cases of out-of-hospital sudden cardiac arrest. These are cardiac arrests caused by a medical event not due to a traumatic injury. Lincoln's survival rate for these cardiac emergencies was 16.9%, compared to a national average of 9%, meaning that of the 148 non-traumatic cardiac arrests in Lincoln almost doubled the opportunity for patients to survive. In Lincoln, when a person in cardiac arrest is encountered, people are more likely to perform CPR prior to the arrival of LFR personnel. Of these 148 non-traumatic cases, bystanders were performing CPR 70.9% of the time when LFR arrived, compared to the national average CPR rate of 40.2%. In 2020, our community brought 25 people back to life from sudden cardiac arrest. These people are now back at home, work, school, and with their families. If we were a completely average community, statistically we should have saved 13 people from sudden cardiac arrest. Due to the hard work of our community members, our 911 dispatchers, our law enforcement, Lincoln Fire and Rescue EMTs and paramedics, our health systems, including nurses, respiratory therapists, emergency physicians, cardiologists, and critical care physicians, we brought 25 people back to life. Chief Engler, I'd like to invite you to come up here and speak now.
Good afternoon. I'm Dave Engler, the Fire Chief for Lincoln Fire and Rescue. I would like to thank you for joining us as we share this important information. This is not just positive news for Lincoln Fire and Rescue, but rather reflects the caliber of people who live here. Every success we enjoy matches the hard work of the women and men of this organization, but also the support of the people of our community. This success is just a small glimpse of the continual outcome-based improvement we strive for daily. The operational decisions we make are driven by data and outcomes. We will continue to work closely with our medical director, Lincoln Hospitals, the Emergency Dispatch Center, to ensure we provide the best chance for pre-hospital cardiac arrest patients. Attention to performance development of community relationships and continual improvement will result in maintaining one of the best performing EMS systems in the country. Thank you. And I'd like to invite Neil Detlefs to the podium. Neil?
I was actually at the right place at the right time to go into cardiac arrest. I was at a wedding reception here in Lincoln when I collapsed. One of the bridesmaids started CPR immediately. The Lincoln Fire and Rescue was there within minutes for support, and then also they transported me to the Nebraska Heart Institute. And I'm here to tell you about this, luckily, because I was in Lincoln when it happened. I want to thank you all for giving me the second chance in my life. Thanks.
Thank you, Neil, for sharing your story. Thank you, Dr. Kruger, for everything that you do. And thank you as well, Chief Engler. While we celebrate the successes of 2020, Lincoln Fire and Rescue is hard at work continuing to meet and exceed those cardiac arrest survival goals set forth in their strategic plan for 2021. And I just want to extend my thanks to all of our LFR employees and teammates and all of the critical care providers for contributing to the remarkable quality of life that we have here in Lincoln. And with that, we would be happy to open up this briefing to any questions that the media may have for any one of us. Mic drop then? No questions? Okay. Bravo, and I would just ask everyone to join me in a round of applause for our LFR team medical care community. Thank you. Thank you again.
No problem.
Well, it's always continued hard work, but one of the things that we've done is we've worked with our medical director and really focused our crews into practicing and preparing for what we call high performance CPR. So we've looked at all the data nationwide. We've implemented frequent training. So just like with any team, the more that you practice, the better you're going to be. And then we certainly have gone out and tried to really push the hands-only CPR that is done so we can get our citizens involved. And then certainly our dispatchers, our 911 center, they're giving pre-arrival instructions, and they've really focused in on recognition of the cardiac arrest early on in the call so we can get that going. And then we're lucky that in our city, we've got a police department that is willing to and does carry AEDs or automatic external defibrillators that they can get to the calls real quick if they're in the area and start that process too. So really what we're seeing from the time that the citizen recognizes cardiac arrest through care in the hospitals and through the medical community, we're seeing just a team approach throughout our community, and that's what makes it successful. One component won't get us where we need to go, but it's all of us practicing, preparing, and just making people aware out in the community. So that's been the key to the success in our city.
He also has a follow-up. Have the news stations contributed to these numbers?
Well, certainly from our standpoint, response time matters, and the sooner we can get ALS intervention or advanced life support intervention to an emergency is critical. So yes, we've seen improvements in reaching those emergencies as a result of the fire stations, the added stations, and the shortened response time. But again, it doesn't all come down to that one component. That's an important component, but the early recognition of the citizen that starts CPR, calls 911, we get the dispatchers out there getting CPR going. I mean, it's just a team effort all the way around. There's not one part of that if we took it out, it would ruin the success. It's a team approach all the way across.
And one more follow-up, and this might be for Dr. Kruger, I'm not sure. Are you pushing or promoting continued spread of AEDs in the community? And also, is there any maintenance, upgrades, et cetera, for AEDs required for institutions that already have them in place?
So recently, we've expanded the number of AEDs in our community by outfitting all of our law enforcement vehicles with AEDs. And just over the last several years, these have expanded out to schools and various community buildings and workout facilities. So the number of AEDs in our community has significantly increased, and our public usage for AEDs in sudden cardiac arrests has been well above the national average for the last several years.
We should mention Pulse Point too.
And Pulse Point has been around for, I think, the last 6 years and is utilized by thousands of people in our community. And we, with sudden cardiac arrests in public areas, we continually get people who respond via their Pulse Point app. So we would encourage any citizen that is interested in learning CPR or knows CPR to download that Pulse Point app as we try to continue to improve as a community.
And also the folks that already have maybe an older or an existing AED, what are you encouraging for that?
I would just encourage them to maintain those AEDs. There is a requirement that they should let Lincoln Fire know that they have an AED so that we're aware of where those are and we can upload those appropriately into Pulse Point, but just kind of follow the manufacturer's instructions on those.
That's it.
Thank you.
Thank you again to everyone who's helped build this web of protection for our community. And we're glad to be able to report out such great success for our community today. Thank you.